For some time now, healthcare facilities across the nation have been dealing with the problem of filling nursing positions with qualified candidates. What might surprise you is that Allen County government has a number of same kind of positions and is also having problems with finding enough candidates to fill those jobs. With me right now is Marlena Lewis. She's the Employment Compensation Specialist for the Human Resources Department here in Allen County government. And Marlena, tell us a little bit about the difficulty that the county has had in filling those positions.
Well, we have 4 departments that hire either RNs or LPNs, and I think the primary problem with it is the lack of awareness within our community that we have other departments besides our health department that hire for these positions.
Are these positions pretty much similar to what you might find in the healthcare industry?
Yes, absolutely. They are. Primarily, they're dealing with either children or inmates in our jail. However, it is pretty similar.
What are some of the benefits of working in the county sector as opposed to maybe working in the private sector for nurses?
Probably the primary benefit is the set hours that an employee can work.
And how would you say the salary or the pay compares to what nursing candidates might find in the private sector?
The salary is very comparable to the private sector. Our nurses and LPNs start out at $16, anywhere between $16 and $21 an hour, and that depends on whether they're part-time, full-time, or they're LPN or RN.
We're speaking now with Pam Thornton. She's the supervisor of nurses here in the Allen County Jail. And Pam, how long have you been working with the county?
I've been here just over 2 years.
Compared to the work you did in the private sector, what is it about county government and nursing positions that you think folks would be surprised to know about?
I think as far as the county government, most people, nurses, think first of the Department of Health, and they think of those positions. They don't really think of the correctional side of it, and that would be here in the jail, the Juvenile Justice Center, and those types of settings.
Now, you worked for who in the private sector, or what area did you work in?
Public health.
And how many nurses do you have here that you supervise?
I have 13 LPNs, 2 paramedics, 4 QMAs, and 1 medical clerk.
When you talk to other folks you know who are in the nursing profession, are they surprised when you tell them you work with Allen County government? Do you think they're aware of what opportunities exist here in the county?
I think they're surprised because, especially when I start talking about the jail, there's a social stigma out there that if you work at the jail, you must not have been able to get a job anyplace else, and that's far from the truth. Here we take care of the people that need the most care in our communities. They've, done something wrong, made mistakes, but by law we still have to provide quality medical care for them. And the majority of these people will be released right back out into our communities. They're our neighbors, our friends, our family members. So I feel I owe it to the community to make sure they're well taken care of here so they don't get out and expose the rest of us to other things.
And the work that you and the other nurses do here in the jail, pretty comparable to what would take place in other healthcare facilities?
Yes, we have, and even here we experience a broad range of illnesses, and we have adults with all types of chronic illnesses, pregnant females, some unfortunately, children that are, under the age of 18 sometimes. So we deal with the whole gamut, plus, medical emergencies are called almost daily for some things, so a lot of autonomy here.
So would you recommend a job in county government for anyone in the nursing profession who's either looking to change fields or get into the profession?
Yes, I would, because you're going to see a wide range of all types of things, and here with this patient base, you're really going to feel like you're making a difference.
Marlena, tell us a little bit about some of the things you've been doing as recruitment specialist in human resources to try and improve the awareness among folks out in the field who might be looking for a nursing position.
Okay, we have reached out to several different colleges. We've expanded our college reach to other universities outside of Indiana as well to try to spark awareness.
I know you have a web page on the internet where you can post this information as well. Is that right?
Yes, absolutely. We have a YouTube site where we're posting information on there for these positions. We've also put together a nurse task force to try to generate ideas with various individuals from the 4 departments.
And you've been doing this for a few weeks now. What kind of response are you seeing?
We are seeing a positive response. Normally a position that would remain open for 1 to 2 years is filling rather quickly. We had an RN position with Youth Services Center that filled in 5 weeks rather than the extended time.
And even if you have all your positions filled, I understand you would like to keep kind of a pool, I guess, of potential candidates for future openings. Is that right?
Yes, absolutely. It would be nice to have a list of interested candidates for positions, so when something comes open, I can contact them and let them know that something's available. It does not guarantee a position with the county. However, it allows us to make them aware of it.
Marlena, thanks a lot for your time. We appreciate it. And a reminder for you that the job postings Marlena talked about are on the Allen County website, www.allencounty.us, and also on the YouTube channel that belongs to Allen County, and that's Allen County Info.